Alena was a 60-year-old teaching assistant who lived with her elderly husband and had 2 adult daughters. Alena had had some breathing problems, but thought it was an untreated cold or high blood pressure. After some examinations, Alena was diagnosed with advanced metastatic lung cancer. The diagnosis came as a shock for the family, because Alena had never had any serious health issues, only minor problems linked to old age. Alena's cancer was treated with chemotherapy and radiation therapy, which helped her a bit, but the side effects made her feel very weak and sick. Alena was unable to work due to her ill health and worried about how she would support herself and the family. A social worker helped her apply for the benefits she was entitled to, and she was quite relieved. Alena had also become quite lonely since she had stopped working, but the social worker put her in touch with a social support group for women living with cancer. Alena's body did not respond well to the therapeutic treatment, and the illness progressed. After a consultation with an oncologist, the treatment was stopped. The oncologist at the hospital discussed her options in terms of palliative treatment, helping her to understand the benefits and drawbacks of each, so that she could make an informed decision. A care plan had to be made. That is, Alena and the palliative team decided how and where the care will take place. Despite the support Alena got, she was often feeling low and was referred to a counsellor. He helped Alena make plans for her and her family after her death, and helped her set up her priorities in her care. The palliative care nurse talked to Alena about the management of her symptoms, particularly the pain, which made it difficult for her to carry out daily activities. As Alena's disease progressed, she grew increasingly tired and weak. Her husband tried to assist, but could not perform all the activities. A community social worker organised a carer to visit twice a day to help Alena get washed and dressed in the morning and ready for bed at night. An occupational therapist visited to advise her on fatigue management, ways to conserve her energy, and arrange for the installation of grab rails. Alena decided that she would like to be cared for at home when she reached the final stages of her illness. Her family supported her decision, and with the help of a mobile hospice team, they managed to coordinate work and care for Alena. They gave her information and choices about her treatment, which enabled her to remain a sense of control. One of the respite workers also helped Alena make a telephone call to her brother in Australia when she was too weak and fatigued to manage this by herself, and she took great comfort in hearing his voice. Alena's health deteriorated. She was weak and tired. Thanks to the medication, she did not suffer from pain or breathlessness. She died peacefully, surrounded by her close family. After Alena's death, the hospice bereavement service continued to support the family and friends. The family appreciated the service and were happy that Alena died in a familiar home setting in comfort and peace.